Hi, good afternoon, everybody, and welcome to our masterclass webinar on accessing GP data with GP Connect. We'll get started in just a couple of minutes. We're just going to give people some time to find the meeting link and to join. So probably give it till about 2 or 3 minutes past, and then we will get started. Okay, well, it's 2 minutes past, and it looks like most people have managed to join now. So I think we'll make a start. We've got some housekeeping to run through anyway. So if anyone joins a little bit late, they won't miss out on too much. Welcome to our final masterclass webinar of this year, just before Christmas. Thank you for everybody joining us this close to the holiday season. We're going to be talking today all about accessing GP data with GP Connect. On the next slide then, please. So just so you know, some housekeeping for this session. This webinar is being recorded, and we will send a recording of this to all of you after the session, either later this afternoon or it will be with you by midday tomorrow. All attendees are on mute and we can't see you. So please do use the Q&A function to ask any questions. If you can't see the Q&A section, it's right down at the bottom of your screen in the middle of the toolbar. Or if you're on a mobile device, you might have to click on the 3 dots to access more settings, and it's available there. If you're having any issues, if you want to introduce yourself, please say hi in the chat. We would love to talk to you. But if possible, please try and use the Q&A for any questions, just so we make sure we don't miss any of them. We have closed captions enabled for anybody who would like to see that, and there will also be a transcript of this entire session made available to you afterwards, and you can also toggle that in your own accessibility settings if that's of use. We will be sharing the presentations, and we have quite a jam-packed agenda today, so hopefully there'll be lots of opportunities for you all to ask questions as we go through. In just a moment, I'll pass over to Alison Taylor from the Digitising Social Care Programme in the NHS Transformation Directorate to give an overview of GP Connect and what it is and its history. We'll then talk to Anita Athel, who owns Wren Hall Nursing Home, to talk about her experiences with GP Connect. And then Andrea Baxter from Baxter's Home Care and Taffy Gatawa from Every Life Technologies to talk about GP Connect in a home care perspective. We will have opportunities for questions after each of the individual presentations, but also have time allocated at the end for moderated Q&A. So don't worry, we won't miss you. But if we do run out of time for any reason, we'll make sure to come back to you via email. We'll finish at 3:30 at the very latest, but potentially if we wrap up a little bit early, I'm sure no one will mind having some time back. Next slide then, please, Eleanor. For anybody who hasn't heard of us at Digital Care Hub, we're a partnership project run by the Care Provider Alliance, and we work very closely with the Digitising Social Care Programme in the Transformation Directorate, and we're really delighted that they've funded us to put on these sessions for you this year. We support adult social care providers across England on anything to do with technology, data protection, and cybersecurity. And we cover almost 10,000 organisations who, across them, employ over 600,000 staff and support nearly 1 million people. So we're trying really hard to help the sector with digitisation. Next slide then, please. So without much further ado, and to try and keep to the agenda, I'll pass over to Alison to get started. Over to you.
Okay, nudge me when I'm coming to the end as well, Katie, because you know I can go on. But hello and thank you everybody for having me. It's good to see so many people on that are interested in this. So I'm Alison. I'm a nurse, but currently working in digitising social care as a senior program manager, covering a portfolio of works around access to information and standards and security and a whole host of things that I never thought I'd get involved in. But GP Connect was my baby about 4 years ago. So I'm just here to share a bit of the journey and some details and then hand over to the people that are still doing it to sell you the benefit. Well, it's not even selling you the benefits. I think you guys know. We've wanted access to information to the GP record for many, many years. I'm in my year of nursing across health and social care. And I think the one thing when I started this was my frustrations over lack of interoperability and being able to share information between ourselves, secondary care, primary care. I'm not saying we've blasted the issue because we haven't. We've started on a journey to give you information, and there's a lot of years ahead to make this really robust and what we need. But starting the journey has been powerful, and that started for me during COVID. So if we can go to the next slide. Before I actually got to GP Connect, I did a little work with NHS Mail, DSPT, and working with Katie in several hats and several roles as well. So what is GP Connect? It's simply accessing the GP systems to get information on your residents where appropriate with the right staff at the right time. CQC registered care providers, any care provider that's registered can have access because I often get asked, does that mean home care? Yes, it does. It means learning disabilities. It means anybody that's CQC registered. There is discussions around non-CQC registered, but that's for the future because it is in discussion like so many things that we haven't got to yet. But for now, the scope of this project and this program is for all CQC registered providers. So there's a couple of caveats before you get the information, which I'm sure you've heard the acronyms of: DSPT and the Assured Suppliers List. Maybe not so much the Assured Suppliers List because that is a program that started 3 years ago. With digital social care records, and obviously we assure them against several standards to make sure that they're safe and secure and that you haven't got to worry, and then you look at your requirements and align to the best supplier that obviously gives you your requirements for your day-to-day running and looking after people. The DSPT, as I said, there is a program out there called Better Security, Better Care, and one of the criteria for you sharing any information to between yourselves, so adult social care or through the NHS, is having the DSPT and making sure that all those cyber security, and Katie is the expert for me on this, she could talk about it every day. So reach out if you haven't done it, if you're on the journey, if you're just starting, there's a free offer for care providers to have that support on a one-to-one level out in the regions. And I'm sure Katie can share any of that detail afterwards because I haven't shared that on these slides, but it is available. Can I have the next slide, please? So about three and a half years ago, maybe, I got given a task to get GP Connect out to adult social care. It's been my passion many years before that, but I finally got into a role here that I could influence the change, bring GPs along with us, bring secondary care along with us. And we all know the battle between GPs and nurses. Obviously, I'm one of them, and doctors and nurses. And I think in the last few years, we've really come over a hump with people wanting to share with social care. I think through COVID, we showed what we do, and people relied on us and stayed away and realised that we do use digital. So the more information we get, the more empowered we feel and the better care we can deliver, quite honestly. So I took the functionality, as we call it, what's available, and thought, okay, what can we do to make people's life easier and just give them a basic set of information. And that's what I did. So looked at the whole record, pulled out some data. That slide tells you what you get: medications, allergies, problems, immunisations. And also what's powerful is the last 3 encounters from the GP, because it tells you what healthcare professional they might have seen. And that gives you an indicator whether you might need to reach out to another healthcare professional or another consultant. And then obviously starts conversations about care you go and reach out to other peers, obviously, and get that information. Where it's a nursing home, they've got a different, or can have a different level of availability of information. And I think Andrea will talk about that as we move through, because I know that in home care, there's nurses, there's carers, there's a bit more mixture. Some care providers don't have nurses, so they just get the single HTML, as we call it, read only view. It's all read only. Don't go away with that message. We're not there yet. The future, the dream is to share both ways and to edit, but we literally are at read only. But it's powerful information that you've not had before. So, you know, we have conversations every day, and this really cuts down you ringing the pharmacies, ringing the GPs, speaking to those receptionists that really don't realise how urgent that information is for you guys. And it cuts that out so much. And the guys later will obviously come on to that. At the moment, we've got, I haven't updated that slide. We've currently got 8 suppliers live on GP Connect, and we've got 11 that are through the assurance. So everybody's working really hard. And the ones that were the early adopters, that I'm sure Taffy will speak about later because she's been on the journey with us, are refreshing that and really getting the message out there to give this a push to get every care provider getting access to this great information. So the next slide is numbers, if I remember correctly, or is it benefits? So benefits, it's just a pictorial slide for you guys to read at your leisure. I don't think I really need to tell you how much it improves your staff experience, reducing phone calls, reducing that time that you actually have to spend chasing for numbers or figures, or when the person last ate or drank, or had a medication change, which is the most benefit that everybody speaks about in the testimonials. But throughout the whole system, this gives us benefits in joining up information at the right time with the right people. So I'll let you read that as your leisure. The next slide, please. So again, this is from care providers that we've worked with, and it comes out in there about not calling the GP of information about. That's the top the top benefit that we come across. But there's also some stories that you're going to hear later, I'm sure, around how this works in practice and reduces clinical safety and actually reduces hospital admissions as well. So I'll let you read those at leisure, but there's lots of testimonials now, because the next slide, I think, is numbers, because I'm sure I've shortened this presentation to allow for others to speak more. We're nearly at 2,000 providers that have got this information now, which is really exciting, and it's like 10% of the whole population of care providers, but we're getting there. And I think this trajectory will be really soaring by the end of the year, because all the suppliers now are really on it and really like promoting it with their providers across the piece. I think having nearly 90,000 individuals' files accessed to give better care is amazing. And obviously nearly 17,000 new staff that are coming to use digital, feeling empowered and not saying, I can't do that, because they want the information, they know it's beneficial, and it's driving confidence for digital. So that's a great thing for me. And that's all that slide is. It's, again, for reflecting on, really. Next slide. Okay, so if we move on again, please. The National Data Sharing Agreement, NIG, it's probably the biggest thing that I've dealt with over the last 4 years consistently. It's improved where we've got the message out there. The DSPT and the teams do an amazing job, but you have to sign the National Data Sharing Agreement before you can get access to the GP Connect. You have to have the DSPT, which I've spoken about before, but that's it. If you've got DSPT at standards met, and you've read all the terms and conditions, because you can amount of the copious pages that they write for these things online. So what we did was took it and really shorten it. So at the bottom of that page, you've got the NHS portal that takes you to that National Data Sharing Agreement digital process, and it takes less than 10 minutes. If you've got your ODS code and you're confident that you're sharing and you've got your position in place, it really is quick. I did it with a provider on Monday. with one of the ICS colleagues, because I don't think anybody believes me when I say it really is that easy. Let's get going. And they've been put live this afternoon, I think. I've got an email to say that it's been processed. So we can do it really quickly, as long as the right people get the right information and supported in the right way. But the system, I can honestly assure you, is there to support you. The IG is in place, and all you have to do is do that national data sharing agreement, and everything else fits in with your normal processes. You're already doing data sharing, and this is just hopefully reducing your burden and not increasing it, because that's the whole reason behind doing these things and sharing information. That's it from me. I'm at time, I think, and I want to allow other people to speak. I'm almost sure I haven't got another slide, but I'll never be too confident. There you go. And happy to take any questions.
Thank you, Alison, for that whistle-stop tour and keeping perfectly to time, which is very, very impressive. Alison's really underselling herself, the amount of work she's done here. I think I first started talking about care home at the time, not just care home, not home care, access to GP records in 2017. I think Alison and I first had this conversation in 2018, 2019. I know Taffy, who's speaking later, has also been on this journey. So it's been a long slog to get there, but I think we're in a really great position now. And if anybody is going to start thinking about read-write access, then Alison is definitely the person who's going to get us there. There is a question which has come through for you, Alison, which is, can you explain where the line is between GP Connect and shared care records?
Oh, depends what line you mean, quite honestly. They're two different programs from NHS England. So within a digital social care record, we use the data set that were created through the standard. The shared care record uses a slightly different data set, and their interoperability journey is just different. And I don't know any more than that, because from last year, the shared care record program as a core central team in NHS England was reduced hugely as a program. So we're engaged at a senior level with that program for the future of interoperability, but that's really as much as I can tell you.
Alison, I think it's fair to say that the shared care record programs are now being kept on at an individual ICS level. So each one will have a slightly different perspective and approach. So if you're interested in shared care records, it's worth reaching out to your local ICS or ICB and finding out what their program is, as GP Connect's a national standard. So it's the same options, the same functionality nationally. Is that right, Alison?
Yeah.
Brilliant. Okay. Great. We do also just have a question, and I don't know if it was on your benefits slide, which is, do you know how much time on average is saved for a provider using GP Connect? I know both our providers later are going to talk about it from their perspective, but do we have an average?
Because yes, there is one, and I know when Taffy and Andrew have spoken before on their slides, they have that. So
brilliant.
I don't want to misquote, but I know for myself, it saved me hours. I still do 2 nursing shifts a week in a month in a care home. And it saved me at least 3 or 4 hours on that shift, ringing people, chasing information, things like that. So that's just anecdotal for myself, but I know that Taffy and other people have done some more in detail work to prove that. So I shall leave them to answer that more fully later, if that's okay.
Yeah, absolutely. And are you able to sort of stick around for a little bit, Alison, in case some more questions come through?
Yeah, I'm just going to go off camera and drink my tea, but I'll be in the background.
That's a shame. We shall miss your Christmas backdrop, but we'll see you back on the call later. Thank you so much. So with that, we'll pass over to our second speaker, who is Anita Assel from Wren Hall Nursing Home. Anita, if I could. Eleanor, maybe if you could bring the slides down, if that's okay, to stop sharing, and then we can see Anita properly.
Hi.
Hi, Anita. How are you?
I'm fine, thank you.
Great. Would you be able to sort of give a bit of an explanation about Wren Hall and your background and what you do in social care?
Yeah, so I'm a registered nurse. I'm also a registered manager. I run our family's nursing home, which is a 54-bedded nursing home. We look after people with complex nursing needs and living with the dementia. We've been using GP Connect now for probably 3-4 years, probably longer. So we find it very useful. It's used every day. It's difficult to say how much time it saves because we didn't have it before. And actually, you know, you need to log on to it. You need to look and read the information. So that takes time, but it definitely does save time. We're not phoning GPs. We're not phoning pharmacies as much, chasing things, and it gives us added clarity of information. So I think it's a brilliant tool.
Amazing. And I know you're using person-centered software, PCS, right, to
Yeah.
set your system. So once you already had PCS, what was the process of sort of setting up GP Connect like for you and making sure the right people had access to the right information?
So obviously, as Alison said, we've completed the DSPT toolkit. We have data sharing agreements with our GP practice and with pharmacy. And obviously, when new people come into the care home, we get them either to consent or their advocates consent for them, so that we can share the information freely. Now, because we've been using GP Connect for so long, it's very quick to get access to individual records. Previously, we had to send through all the consent forms to the GP practice, and then they'd give us access. But now, once they know there's a new resident for the care home, they give us automatic access to GP Connect, obviously providing the individuals consented to that. And then from day one, we can access their full GP record and gain clarity.
Sounds amazing. And I know we've spoken before about the GP also really likes it. And so what's sort of the benefits for them?
There's benefits for everybody. So for the GP, the benefit is when the GPs come out to us, they rarely have access to their computer records. So in our area, the GPs use System 1. So they don't always have access to System 1. And sometimes they'll say, oh, I need to go back and read up on their record, and then I can come, you know, I'll get back to you. But now we can say to them, well, we can pull up the record for you and you can read it. And so that speeds up things for the GP. We do have issues occasionally where GPs have come out and they'll say, oh, I'm going to prescribe an antibiotic, for instance, amoxicillin, and then they don't prescribe. They forget by the time they've gone to back to the surgery, or they don't prescribe that, they prescribe something else. So we can look on GP Connect and see what their rationale for that prescription is, and then make a clinical judgment. Do I need to talk to them about it, or, you know, is that the right thing that we do? We've also had situations where people have been discharged from hospital and their medication dose has changed. The discharge letter gives no indication of the change, or we've had conflict between what the discharge letter says and what the prescription on the instructions on the medication bottle says. And so we can read on GP Connect and see what it should be. Previously, we would have had to contact the hospital. Usually the medical records have gone back to be archived, and then we can find that, you know, we can have that conversation more freely with the GP, and you know, that works well. I've just seen Alison said she didn't believe something's correct.
Oh, yeah. So
What's
there
that?
was a question which came through to the panelists about, is GP Connect similar to Coordinate My Care? I don't know if you've
Oh,
used
right.
Coordinate My Care, Anita.
No.
I haven't used it for several years. Alison, I don't know if you wanted to just sort of say out loud quickly what your
I just
answers.
put that. I don't know what it's at now and what functionality it uses, but I don't believe it's information from the GP record as GP Connect is. If you do get some information from the record, it'll be quite, I don't want to be techie, the coding will be quite small and you'll get even less information. So I don't want to quote on something that I haven't used for many years, but I don't believe it's the same thing as Cold Donate My Care.
That's so
Okay,
helpful.
sorry about that. I just thought I was giving wrong
No,
information.
you're not giving wrong information at all. And for anybody on the call interested in coordinating my care, we'll do some digging and come back to you via email with more information. But sorry, Anita, back to you to talk about GP Connect.
Okay. And then benefit from a relative's point of view. Last week, a relative came to see me. I didn't know what he was coming to see me for. And he actually wanted an update on his wife's health status. Now, I'm probably not the best person to ask that information from because I don't care for his wife on a day-to-day basis. So that conversation would have been better directed at one of our nurses. But I was able to log on to GP Connect. I was able to answer all of his questions. And he left a very happy man with all the information and, thought that it was amazing that we had all this information at our fingertips. So we've seen benefits from multiple perspectives. We've also had issues where our pharmacy has told us that they haven't received the prescriptions that we've requested for, but we've been able to log on to GP Connect. We can see that the GP has signed the prescription and it's gone to the pharmacy. And so it stops people fobbing us off, I think, and we can say, well, you had it on this date at this time. So now can you deliver the medication, please? So multiple benefits that we've found.
That sounds fantastic. And we have had this question a couple of times in the chat, but just to confirm, so do you have to pay to use GP Connect?
No.
No, just part of your standard agreement with person-centered software.
Yeah,
that's true as well for all of the other software companies. I'm not saying PCS is the only one, it's free. Any of the assurance solutions who have that functionality enabled.
And Alison did say that nursing homes have a different level of access. So we put our PIN number. So each nurse has to put their PIN number in to PCS on their profile. And that then gives them, that's their access to GP Connect. And then once that PIN number's in there, all we need to do is click on the GP Connect button and we get all the information about the individual.
Amazing. And how do the staff find using it?
Our nursing team feels really empowered by having access to it. To be honest, our care staff don't use it. It has got a lot of, well, it's got everything to do with the person's health record on there. And, we are dealing with confidential information, so it's not widely available. Like I say, the nurses have to use their PIN to be able to get access. And so it is our nurses that use GP Connect.
Fantastic. Thank you for that really amazing overview of how you're using it, Anita. I know you do need to drop off quite soon for other things. Is there anything else you want to sort of share about GP Connect before that?
No, happy to have discussions. If anybody wants to have a chat about it, happy to do that. But it is really, it has transformed the way in which we deliver care, because previously we had to phone in the GP practices, we'd then be put on hold, or we'd be told the GP had phoned back. It could have been a couple of days later that we got the call back. So, it's information at our fingertips, literally.
That's Amazing. Thank you. If anybody does have questions for Anita, do keep putting them through to the chat. If Anita can't take them right now, we can always make sure we put you in touch over email or follow up in that way. But thank you so much, Anita, for that. That's really, really helpful.
Thank you.
Thanks. So we have had quite a lot of people who have been asking on how they access GP Connect. If you're interested, Alison and I have just shared a link in the chat on how to apply for GP Connect, and I am fairly certain that Taffy and Andrea are going to talk about that in a lot more detail in the next session. So now we've heard from a nursing home perspective what it's like to use GP Connect. I'd like to invite Taffy and Andrea to come on screen and turn the cameras on to talk from a home care perspective and a different software supplier and what that looks like. Over to you both.
Excellent. Good afternoon, everyone, and thank you, Katie, for having myself and Andrea to talk about GP Connect from a home care perspective. My name is Taffy Gatawa. I'm the Chief Information Officer at EveryLife Technologies. So we provide a digital social care record, which is primarily used within the home care space. I'm excited to be joined by Andrea, and in a minute I'll hand over to Andrea to introduce herself and talk a bit about her service. But Andrea was the first to go live with GP Connect in social care. So it's always really interesting to hear from Andrea and the impact GP Connect has had in her service. So Andrea, if I hand over to you to introduce yourself and maybe just say a brief outline of your home care service, please.
Hi, I'm Andrea. I am the registered manager at Baxter Home Care, which is a complex home care, and Evermore House, which is a complex in-house unit. I am a registered nurse. My background is in general surgery and urology. We have been operating in dumb care for over 8 years now, and our care home is in service for about 2 years now. So we went live with GP Connect in December 2020. So we were the first guinea pig. And here we are. Looking back to 4 years ago, this month is actually 4 years. Looking back to 4 years ago, I can't imagine running dumb care and a care home without having access to GP Connect.
Excellent. Thank you, Andrea. So talk us through, I know a lot of that has been covered in some of Anita's talk, but if you just want to outline just the process of implementing GP Connect, I can see there's a lot of questions. So maybe you can help demystify just the ease of that. What was that like for you implementing GP Connect, not least as the guinea pig?
So, I mean, when I was approached by PASS, I'm not going to sit here and tell you that I was just yes and confident. I mean, there was no one with prior experience for me to talk to say what was their experience of using it. So, of course, I was a little bit anxious and not sure what's around the corner, but it was really easy to set up. And I remember PASS working with us and asking, are you live? And, I remember getting access to the first individual. And so when we got access in December 2020, the people that we were already supporting who didn't know about GP Connect, we had to have a discussion with them. And so to let them know that we can now see their GP records and this is when we would need to access it. And we'll give practical examples and scenarios of when we would need to access it. However, what we did from December 2020, it forms a part of the assessment. So whenever I go out to do an assessment of a new individual that we're going to cater for, we always ensure that they know that we have access to their GP records, and we give them examples of when we use it. You don't just log in and view their records if there's no need to do it, but it's pretty easy to set up.
Brilliant. And I like the way you describe, giving live examples so people understand, what are they consenting for and the times in which you might access that record. Someone asked about time savings, and I've posted there in the chat, sort of based on our surveys that we did. So just for context, what we did after a few years of having GP Connect, we did a survey across our live customers that are using GP Connect to really try and quantify, the time saving, and then also try and extrapolate what that might mean from a financial point of view. So the numbers I've posted are based on average, and this was around people telling us how long they might be waiting on the phone, for example, the back and forth. I think for one provider we spoke to, they needed to go back, physically to a GP, for example, whenever they needed information. So we've used that time to try and extrapolate what that means in terms of time saving, etc. So that's what the basis of that is. There is a benefit paper that we've written, so we can share that with Katie's permission. We can share that here. There's also a wider benefits paper that was written by CASPER, which is the Association for Care Software Providers, working alongside NHS England, where we did a whole piece across the suppliers that are live or that were live at that time with GP Connect to really try and understand what those benefits are. And I can see Katie has posted that. And that just helps articulate some of the benefits which are far-reaching, and I know Andrea will give us some live examples of that in a minute. So Andrea, if you want to just describe what you did in terms of getting information before GP Connect and how that has transformed since you went live with GP Connect, and just some examples would be really useful.
That's fine. Before I touch on that, Taffy, when you talk about time saving, I think the time saving would vary from service to service. I know definitely for us, who deals with people with a wide range of complex needs, and we need to constantly be ringing the GP or constantly be changing things, especially people who are on varying doses of medications. We have people in the community who you would send off blood results, and once the blood result is back, the GP would change the medication dosage. Prior to that, you'd be phoning up all the time. Now you just know that you're waiting for the blood result to come out. You just log on. So I think time savings vary. For us, we can say we definitely save more than 30 hours per month.
That's brilliant. That's brilliant. Actually, that's a really useful context that, dependable on the service, that can vary quite widely in terms of that saving. So yeah, I think that average sounds like it's quite conservative based on some services and how they might use that. And so what's been the impact in your service from a care quality and safety perspective? Have you got any examples that you can use to bring that to life for people?
I think the impact for me is, as a registered manager and a clinician, I get assurance. So I get the reassurance that the details that I'm putting down to formulate the care plan, I'm getting it from a reliable source. It helps me to create a comprehensive care plan. So I have history taking going back years back. This is not something you get of someone who's just been discharged from hospital and coming out with just a discharge summary. I have the history of what happened prior, leading up to this admission. And also, I know Anita touched earlier on about when someone comes out of hospital. So we will go in and pick up a care package, and what the individual comes home with and what we go on GP Connect and see is completely different. So in terms of safety, the service user, there's definitely a massive benefit.
Brilliant. Thank you, Andrea. And one of the things that I think is also reflected in some of the questions in the chat. So it's interesting because in one of the conversations we had very early on around GP Connect, when as a supplier, we were invited to consider doing the piece of work to get assurance by what was then NHS Digital to enable this access in our system. It became very clear quite quickly that we were looking at two different scenarios based on whether people were operating in home care or operating in care homes. And that key difference was around the availability of clinicians in those settings. We're lucky today that we've got Andrea, who's also a registered nurse working in home care. But one of the things that we highlighted quite quickly was that in the home care space, you had comparatively less clinicians per service, if at all, compared to a nursing home setting. And so yes, we were able to get Andrea up and running, but when we looked across our customer base as PASS, we found that I think in the first sort of 18 months or so, we were only able to get up to 20 providers live, just because there weren't the number of clinicians in home care, which felt like a real missed opportunity. And so with Alison championing and others, we began the conversation of saying, look, we're hearing the benefits of GP Connect. We need to make this available more widely to other social care professionals, and let's think about the safeguards that we have. And I know somebody has asked the question of what does that look like in a setting where you don't have clinicians? So again, Alison can probably speak more to this, but after a lengthy piece of work engaging with a number of stakeholders, including the BMA, so the British Medical Association, the Information Commissioner, the National Data Guardian, etc., we managed to get approval to give access to GP Connect, albeit I think Alison called it a slimmed down version, to non-nurses in home care, which was a huge milestone because we just won this ability to have this GP record accessible in social care, but then there was this limitation that only clinicians could have it. So it felt like a missed opportunity. So having done that piece of work and got that approval, we then could extend that. And we just saw the increase in uptake after that approval was given. And the critical information that people need, like allergies, last contacts, immunizations, medication, is available for both levels of access. So Andrea, as a nurse, she's got fuller access, but there's other people in your service, and Andrea, you may be able to describe that in a minute, who are senior carers who also have access to aspects of the record, albeit not the full view that Andrea and Anita have described. And the precondition there is having completed your DSPT at the satisfactory standards. I think the minimum standard is standards met. And provided you've done that, it's really easy for suppliers to walk you through that process of then having got your DSPT, how you get GP Connect, provided that system that you're using has gone through the assurance process. And I think Alison had numbers in her talk of how many suppliers so far have got that enabled within their system. Andrea, do you want to say anything about the fact that you've got the two access within your service and how that helps, either from an efficiency point of view or, yeah?
Yes, so our admin has the slimmed down version. I think she can see the last 3 entries that's made by the surgery, and she can see the medication. So when medications is prescribed, she can see the date it was prescribed and sent off. That helps significantly because in the past, prior to you giving access to non-clinical team, they would have to rely on me to have a look in the system and tell them this information. It is not, when speaking to other providers, and I think a lot of them express concerns about non-clinical team having access to the records. You know, the information that you have access to is pretty standard and self-explanatory. So the GP will write, seen XYZ at such a time, the medication sent off to the pharmacy. So for anyone who has admin or senior care staff who helps out, yeah, the slimmed down version would work for them.
Brilliant. Thank you, Andrea. And what's been the kind of feedback, reaction of people that you support and their families to GP Connect? I know you touched on it briefly, but can you give some further examples?
I think for the people that we support, especially in the dumb care setting, we do support a lot of people who lives alone, vulnerable people who lives alone, and their next of kin is sometimes not in this country or close by. And so families are aware that we have access and we can see the GP record. It was just last week we were supporting a gentleman. The GP came out after 5 on a Friday evening. He was diagnosed with a UTI. I was able to log onto the system at 5:45 in the evening and see that antibiotic is being prescribed. Now, in the past, I would have to wait until Monday morning. Then I would ring the surgeon to find out what transpired Friday evening. By Saturday, 11 o'clock, we had the antibiotic picked up and started. Now, if that was previously before GP Connect, we're looking at about Tuesday, Wednesday before the antibiotic would have started. So it definitely increased efficiency in delivering care.
It's a really good example, and also just reducing avoidable harm by being able to start some of those, particularly antibiotics, which are critical meds, being able to start those as soon as they're prescribed means that delay means that they've got a good outcome. So no, that's really helpful. Andrea, is there anything else you want to add in terms of GP Connect, be it benefits, the impact it's had on your service, or just some other examples? I have to say, every time I speak to Andrea, I'm always amazed at the wonderful examples that she shares. And it's often things that when we were talking about implementing GP Connect in our system, we couldn't have anticipated the type of situations or, some of the benefits that would be realized. And it takes speaking to people like Andrea and Anita to surface some of those benefits.
I think this question probably directed at Alison. Alison, does hospices have access?
If they're using a digital social care record, yes, but hospices are a strange being because they're CQC registered, but funded by different arenas. So they often use GP systems, so TPP and EMIS, so they get direct access.
Okay, so I think one of the reasons why I ask you is because we do quite a lot of end of life care as well. And oftentimes when we go out to do joint review with the CNS, the clinical nurse specialist from the hospice, and they would often say to the service user, we're going to go back and phone the GP and see, and I'm able to just take out my iPad and just log in and tell them what the GP actually says. And I'm often saying, it would
Sorry.
be easier. Sorry, Alison.
No, there's a delay. Sorry, I was going to come in. I thought you'd stop. But hospices are in the same space as care providers. They're varied across the country and regionally, so it depends what digital they've got going on. So a lot of homes I work in locally, I'm in Essex, they do have access to TPP and EMIS directly, so they wouldn't need GP Connect. So where they're not digital and they've got a digital social care record and the hospital on board that way, absolutely. Hospices also have shared care records in some areas. So again, it's very much led by the ICS and what their digital journey is and how they're strategically managing hospices. But they're another care environment, should we say, that's a different domain that also needs looking at for the future for digital. But yeah, they should have everything we've got. Everyone that cares should have everything. But I think systems wise, they're in a very, very unsettled space in hospices because of the way that our whole system works, really. But they have got access in some places and not others, which is quite frustrating.
Yeah, I think that is where I'd like to see the gap close. Yeah. But also, I know, touch back to what Taku says, some of the benefits. I know when there's a referral done by the GP to external clinicians, we can see when the outcome will come back to the GP and they've noted things to follow up on the system. And so if you're supporting someone who's anxious, trying to figure out whether the GP sent the referral off or not, that's something that we can tell them, yes, the referral was sent off. Yes, the referral is back.
That's brilliant. I think just having that ready access to information just means you can take those, decisions, or at least you've got that holistic view of what's happening. In the past, Andrea, you've spoken about just the assurance that's given to the service with, like, I think you gave one example of even carers being able to say to you, oh, can you just check GP Connect so that,
yeah, because in dumb care, so not everyone that we support has 24-hour care. Not everyone that we support has someone at home with them. And so the carers will go on a visit and they'll say, oh, the doctor's been out to see me. And that's all the individual can remember to tell the carers. And then the carers will just pop us a message back and tell us, Joe Bloggs has said the GP has been out. Can you just check GP Connect and tell us? So I think everybody in the service has gotten so used to having access to GP Connect.
That's brilliant. I think that's a perfect place to end. So unless there's any questions, or Katie, I think you might have a Q&A session and we can take more questions there. I was just going to address one quick question I think that I saw, or I think you've done it, Katie, which was around clarifying how do I know if my supplier has got GP Connect, but you've answered that one.
Thank you, Taffy. Thank you, Andrea. Yes, I was just typing rapidly in the chat while you're wrapping that up. I think that was just so helpful to really understand sort of the journey and the benefits and all of the different ways that it can bring real benefits to staff, to families, to people we're supporting. So that was fantastic. We have had quite a lot of questions. So what I'll do is I'll also bring Alison on as a spotlight, because I think it's going to be a bit of a mixture on who is the right person to answer these questions. So I know there have been a lot of questions around how people actually go about applying for GP Connect. So to be really clear, Alison, could you just sort of say how people check if their existing digital social care record solution is able to use GP Connect or not? I mean, you're on mute. Sorry, Alison.
Yeah, cool. So, the first stage I'd say is ask them. You should have a relationship with your IT supplier. If you haven't, get one, because that's the best way to work with them, and ask them where they are in their GP Connect journey. Currently on the assured supply list, which Katie, I know you'll have that linked hand, on the listings page, it will tell you who has been assured and who hasn't been assured. Claire and team work on that quite a lot, and it's not as live as we'd like it to be because we haven't got the resources. But as suppliers get over the line, the listings page does tell you who is compliant. But I would always go straight to my supplier. If I'm working with a supplier and want something from them, I would be asking them. And the process for you guys is on that second or third slide that we'll share after this webinar. Make sure you've got your DSPT and go into the National Data Sharing Agreement that both Katie and I shared, and you work through the process on the screen. It is so easy. I wish I could demo it, because I did it with a care provider the other day and said, damn, we should have recorded that. And we could have snipped it and just played that, because literally it took about a minute and a half once you know what you're doing to click through. So I know somebody's trying it because we've had some questions today. So when you go in, it asks for your GP supplier. So as I say, that's your digital social care record supplier. If you're in secondary care, they would pick other systems, and that's why it's a massive list now of people that are assured against it. You then move on to another screen that says confirm your ODS code. And then you put in your ODS code. If you don't know your ODS code, there's a link on there for you to open the ODS page. You put in your postcode quite simply, and it brings up the ODS code. Now, if you've never dealt with ODS codes before, they're a background thing. They stand for Organisational Data Service or SET. Yeah, good, excellent. And basically, you'll start with a V number. So you'll get a list of ODS codes, both that are archived and some are new. So when you're looking at the list, please make sure, although it's associated with your postcode, that you use the one that's active. I've had a few people come saying this doesn't work, and that's because they've used the inactive there. So just make sure you use that. Once that's in, it will just then confirm that you've got the right address. You then go through to say, oh, why are we sharing this? And your social care. So you click on the social care box, and we've done the work for you again in the last however many years we've all worked on this, and it gives you a whole little ditty on how you're sharing for direct care, written in the right language by very clever IT people. And you just agree to that and click the next step. It then goes through, I think, 3 or 4 more buttons where you just agree, asking you about your policies and procedures you've got in place that you do every day. And you click to confirm. Once you've confirmed it, you'll then get an email that says you've signed up, new request. Within a couple of hours the other day, the home manager then got you're approved. She sent that to, I'm going to call them the customer relationship manager within the supplier. That might be different for different suppliers, but that's my terminology, a customer relations manager. Sent it to a mailbox, they picked it up. The supplier will then request a code, which is a technical code called ASID, to then give you an endpoint to link to. Bing, bang, bong, you should then get access after the conversation about your role-based access, about who's getting what access. And we've spoken about clinical, non-clinical. And that's for you to decide locally. You guys run your care home, you manage your care home effectively, you know the right people that you need to share the right access with. And that's it.
Alison.
Sounds like a lot of steps, but actually in reality, it's very quick.
Yeah.
It is very, very quick. And certainly for someone like Andrea, who went first, it was a lot more streamlined than that. So with all the V codes, all of the SIDs, and yeah, but even then, it's still very, very quick. So don't be daunted by that.
Clicks, Taffy. So compared to what you used to do before, to get through the process, 11 clicks, how many years later? I think it's a marvellous achievement for all of us. And you went through the same pain, but somebody has to first, and you've done a wonderful job. So I think it's amazing that we've now got to this stage. To see it is great. And you guys have got the benefits of all that, and having the ease of the burden, really, which is great. That's why we've done what we've done.
Yeah, absolutely. And, you know, I can't stress that, you know, don't be daunted by the process. It really is so straightforward. And any supplier who's gone through the assurance is going to be very familiar with the process, and they will guide you through it. Because certainly speaking from a supplier perspective, we're really keen to see adoption of GP Connect. So I think most suppliers that have gone through this will be keen to get you on their system using it. So they will walk you through it and will guide you through the process.
Wonderful. Thank you so much for going through that in so much detail, and for also explaining ODS codes, Alison. I've popped some links into the chat for people, which we will also share afterwards, for where you can find more information about finding your ODS code if you're having any issues with that. Your software supplier may well be able to help you, or you're also very welcome to call our free helpline as well, and we will look that up for you and make sure you've got the correct code so you can go forward. Similarly as well, for any help with your data security and protection toolkit, there is free support for that. This is one for all of the panel. I know we've answered it before, but people are very concerned. Can we confirm you don't have to pay for GP Connect? It's all free.
No, you don't have to pay. It's free. But also, I've seen a question here from Margaret. It says, I'm a registered manager in home care, but I'm not a nurse, so would I get limited access? But even the limited access that you get, Margaret, is pretty important. You get a lot of stuff from the limited access. So yes.
That's really helpful. Thank you, Andrea. And we have a question here from Sandra as well, who asks, if you have several registered services, do they all have to be set up separately, or can they be done all in one go?
They have to be done per ODS code. So
Okay.
if you've got separate services registered under a site code, because it's done by site code, the ODS, then yes.
And then there's a question from James, who potentially is a software supplier, who is saying, what do we do if we are not on the assured solutions list?
You could contact the GP Connect generic email that I can dig out that you can contact.
Brilliant. We'll pop that into the chat. And I've also popped the link into there's a guidance page on the Digitising Social Care website, which is Alison's team, all for software suppliers, about how to join the list. And I don't know, Taffy, if you want to comment at all about the process of that, what it was like.
I'm very happy to speak to it. So there are a number of standards that as a software supplier you need to be assured against and meet to be on that assured solutions list. And then specifically to GP Connect, I mean, it's one of the standards. There's then a further bit of assurance that you need to do, which is really around ensuring technical assurance of your system, and then also a clinical safety assessment for your system. Again, the GP Connect team, Alison and her team, will guide you through that, but you do have to meet those standards. And I think one of the things perhaps we didn't speak in a lot of detail up until now was really this was a journey of getting approval, convincing people that from a social care perspective, we have the right safeguards to be able to have access to this very sensitive information about people. And so all of those steps are built in so that by the time you get the access, you have demonstrated as a supplier that you meet those standards and that you will take the reasonable steps to ensure the safety of that information. In the same way that providers are asked to then complete the DSPT and attest to good governance and security. So you do need to meet those. So there's a piece around getting on the list and then specific assurance around GP Connect itself to have that integration in your system.
Wonderful. Thank you. I think it looks like we may have answered all of the questions. We'll give some people some time to have a think on, but I just wanted to offer you all the opportunity to add any further thoughts or comments if there was anything else you felt has been missed or you'd like to add. It's fine if not.
I don't think so. I'd just encourage people to just go and do it.
Absolutely.
Yeah.
Get GP Connect.
But also, I can only speak from digital software PASS, because PASS is what we use. I think it's also worth knowing that if you're in PASS and you need to go to GP Connect, you need to enter your password again, so it's perfectly safe.
And Anita, who was here before but sadly couldn't stay, was using PCS, so a different software system, but also seeing a lot of the same benefits that you see with PASS. So there might be minor differences in the functionality of how it presents within your software, but that's something your supplier will work through with you.
I think I can safely say every supplier has a GP Connect button in their system, and you click it and you put your password in and you get access. So whether it looks yellow, green, blue, black with a red ring around it, it's in their system so that you can access it via that. That is the whole point of the integration. Absolutely.
Yeah, so we've tried to make it very easy. So once you've gone through that assurance process, it is, as Alison saying, you will be presented with an extra tab or button which takes you to GP Connect. So quite straightforward. There's a question here. Katie, do we have time for me to just quickly answer this question? Which is around, as a supplier, what security standards do you have to meet as well? I'm guessing this is in relation to the assured solutions. So there is a whole standard around cyber that you have to meet, and that is independently assessed by NHS, in the transformation director team. So they will assess your kind of security posture, I guess. And then there's a standard around hosting and infrastructure, and then there's a standard around data migration. So that's more from, I guess, from the security standpoint. You'd need to satisfy those standards, and then obviously, like I've said, the assurance part for GP Connect specifically.
Thank you for covering that. And Alison has just popped a link in the chat, so I'm just going to share that with everybody as well, where you can see a full list of all of the standards which all software solutions which are on the assured solutions list have been assured as having met. I believe there's also, it's an annual check, is it, for those standards as well? So it's not a one and done. You don't have to worry that people have been there, but it's maybe 5 or 6 years old. They do need to make sure they're keeping up with those standards, and new standards are being introduced all of the time. And if you go to that assured solutions page, it's really transparent. The Digitising Social Care team do an amazing job of updating sort of who's meeting which standards, whether they're in progress, whether it's fully completed. And it's worth having a chat as well with your software suppliers as well. If it says in progress, then it's sort of something they're actively working on, and you can speak to them about timelines. People are very happy to have conversations. It's quite a lot of development work that these software companies are doing. And as been mentioned several times, it's to provide free functionality within your existing software systems. So people have been going on a very quick journey over the last couple of years. If that is all of the questions, I would just like to spend a couple of moments to say thank you so much to all of our speakers today who've given their time so freely on this, especially this close to Christmas. It's a very, very busy time of year. Thank you to everybody for all of your questions. We will share a recording of this session with you all afterwards. We will also send out Alison's slides and the very many links that have gone out in the chat to make sure that you all have those. If you need to make the business case for GP Connect to any sort of senior leaders in your organisation and would like some help, can't recommend enough the Casper white paper, which Taffy mentioned, which really talks about the benefits across multiple different software companies. Sometimes it's really handy to have these things to help with that decision making. But please do get in touch with us as well via email if you have any further questions. But thank you very much for joining us today, and wishing you a very Merry Christmas when it comes.
Thank you, Katie, and thank you for having us.
Thank you.
Thanks, guys. See you later.